You're going to hear more about that. I learned and I taught that for a number of years before I actually figured out how to make it work for me. So if you can share with them the secrets of how to put stages of change strategy into work, it'll make your life so much easier, I promise. How do you assess if somebody's ready? It's pretty easy. You ask them. On a scale of 1 to 10, how ready are you to make some changes in what you're eating? How ready are you to make some changes in your physical activity? If they tell you that they're somewhere around a 3 or a 4, first of all, I'd get excited. I say, that's great. I'm really glad to hear you're a 3 or a 4 and not a 1. That's the psychologist in me. What would it take to get you up to a 5 or 6? I'm not going to try and get them to lose weight. They're clearly not ready if they're a 3 or 4. But I am going to try and move them along. And that's what I want them to start thinking of. What is it going to take to get you ready to lose weight? And then, of course, we want to talk with them about the best approach to do this. Now, we've learned a lot in the last 10 years. You're going to hear Declan talk some more about the best dietary approach in a few minutes. You're going to hear lots more about that, actually, over the next day and a half. I'll just summarize by saying there's no perfect approach. What's really important is to find something that's going to work for the individual. It is going to involve cutting calories, and how they go about cutting calories can be done in a number of ways, but it's really important that we stress the use of evidence-based diets and not fad diets. The evidence in North America, at least, and through Europe, has shown conclusively that most people do better when they do this with some support. Yes, people can do it individually. Men, in particular, tend to prefer to do it individually, in my experience. But women often do much better when they're part of a group. The support of the group really does make a difference. The more intense the program, the better the outcomes. And right now what we're seeing is the best outcomes come when somebody is meeting with an interventionist about 14 times over the course of 6 months. So usually it starts out weekly for a couple of months, and then it slows down a little bit. But it's fairly intense, but the reality is that's what it takes. You can do it through web-based programs, you can do it with phone-based programs. They're not as effective, the results aren't impressive. But if that's where the person's willing to start and able to start, I'll go with that. Physical activity, of course, incredibly important. You can absolutely lose weight by reducing your calories. You're not going to be able to keep weight off over the long run unless you're willing to be hungry the rest of your life. So we've got to get people more physically active. We've got to give them the extra leniency that physical activity gives them to be able to overeat, especially with all of the great foods that I have been enjoying here. I am definitely not going home any leaner than I arrived in Kuwait. And keeping weight off over the long run, again, what the evidence shows us is that people need help and support doing this as well. So 1 year of support is what's making the biggest difference. Now that support may be on a monthly basis, it may be phone calls, it may be through the internet, we can be much more creative, but it also involves a few key pieces. People have to remain physically active and high levels of physical activity. Again, you'll hear more on this tomorrow. People have to weigh themselves regularly, at least once a week. I remember one patient who came in, he stopped weighing himself. He actually had gained 100 pounds. 100 pounds would be, what, 65 kilos? He'd stopped, he knew he gained weight. He had no idea he had gained that much weight. Weighing yourself regularly is key to keeping it off. We need to get that message out to patients, and we need to keep reinforcing to them, yes, they are going to have to eat less to maintain that lower body weight. So I think with that, I will stop here and see if we have a couple of minutes for a question or two.
Well, let's take the questions at the end. Is that all right? We're running 5 minutes late, but we've still got 15 minutes. Thank you very much indeed for that very illuminating lecture. Now we have Declan Fields. He's come all the way from beautiful Scotland. He's originally even more superior because he comes from Ireland. And he has worked with many of my colleagues in Scotland and has extensive experience, and he's going to talk about the role of dietitians in obesity management.